in Geneva, but I'm happy to join this event through this video system. And from our side, climate change is very much felt through various sectors. We have earlier been talking about impacts on economy. We expect that climate change is the biggest threat for global economy, even during the coming 10 years. But today we are talking about health implications of climate variability and climate change, and it was already fairly clear from the previous IPCC report, and it's also clear from this report that we are releasing today that climate change is having serious health implications, and we have also studied how the governments see this situation, and they see that health protection is a high priority for almost all countries worldwide. Unfortunately, only half of our countries are able to provide heat health warning services. So when high impact heat event hits a country, quite often the population is not aware of the warning, and that's why we have more casualties than in the case that we would have proper services in place. And climate change is also having impacts on vector-borne diseases like malaria, dengue fever, and so forth. And in this study, we have shown that the most vulnerable populations in less developed countries, they are more threatened by these changes. And food insecurity, which we have had a fairly positive trend during the coming past 15 years. Unfortunately, during the past years, we have seen negative trend again, so that the food insecurity is growing, and these heat waves are making it even more serious. And for example, in the Horn of Africa, during the past 3 years, we had very severe food insecurity situation, which was related to both heat and drought. And quite often in these episodes, when we have heat waves, we have also fairly poor air quality. For example, in 2003, when we got 75,000 casualties in Europe, at the same time, the surface ozone concentrations were very, very high. And in 2010, when there were 50,000 casualties in Russia, the poor air quality, which was related to forest and peat fires, was part of the problem. And if you look at the global map, the most sensitive countries are in Africa and in southern Asia. And if you read the most recent IPCC report, the report was saying clearly that practically the whole world has been experiencing growth of heat waves. About half of the planet has been facing growth in flooding cases, and about 1/3 of the planet has been facing increase of drought events. And in these sensitive parts of the world, especially in Southern Asia and Africa, the population growth is also one of the challenges. Once we overlay those challenges, the situation is even more devastating. And as I was saying in our previous press conference, there's no more return back to the good old milder climate of last century. Actually, we are heading towards warmer climate for the coming decades anyhow. And if we are successful, we could phase out this negative trend and reach the Paris 1.5 to 2 degrees limits around 2060s. But until then, we will see this situation getting worse. And in the IPCC report, it was also shown that the combined impact of higher temperatures and higher humidity is going to be a challenge. It's already a challenge for the low latitude areas, but this area where this will be felt is going to get wider, independent of our success of climate mitigation. And then the countries are very interested in these health issues related to climate change, and that was also shown in a study where 91% of the countries indicated as part of their NDCs that health is a high priority for them. And then what we have also we have been facing is that only every fifth country is using these data at the ministry level. So the ministries for health are not used to have such services, and only 1/3 of our members are able to provide high quality health services. And our estimation is that it's about 500,000 people who are dying on an annual basis during the past 20 years, and because of the extreme heat, and it's mostly in Asian countries and European countries where the sensitivity is highest. That's in a nutshell what I was having as an introduction to this event.
Thank you very much, Professor Talas. Dr. Joy Shumake, do you want to show a couple of slides, maybe?
Certainly. On the case.
Can we show the slides once she's done the introduction? Thank you.
Only the case studies or all of the slides?
Okay, go with the case studies, maybe.
I don't know, Petri, if you wanted to show the slides or not.
I don't know. Professor Talas, do you want to show the slides as well, or do you want Joy to show them?
So Joy is free to show them. Please go ahead.
Press the button. Can just go over the slides.
Great. Thank you. So as has just been introduced, the State of Climate Services for Health is responding to a significant challenge that is faced by the health community to address climate change. And what we have learned through this report is one of challenge, but one of optimism, because we have also seen that countries are prioritizing health within their nationally determined contributions and starting to take climate change seriously in their national local policies. We have seen through this report that there is significant potential to better utilize the advances in science and technology from the climate community in how the health sector makes decisions and plans for both emergencies related to climate as well as long-term adaptation. As Professor Talas has mentioned, we also see major gaps, particularly in early warning systems for climate-related impacts, such as extreme heat, where only half of countries are now receiving warnings to the public about how dangerous heat conditions might be affecting them. And so to be able to address these gaps, we also see that there's significant potential to transform how we are developing but also delivering climate science for the health community. And in the following slides, I'll unpack a few of these with additional details. So the impacts of climate change on health are wide-ranging, affecting the determinants of health, from social behaviors to water safety to air quality and food security. And we see that it is the most vulnerable countries that are impacted the most by climate change, and particularly low and middle income countries are being impacted heavily by climate change. Next slide. We see in this slide from the IPCC a summary of the vulnerability to climate change impacts. And you can see that there's an overwhelming burden upon the African continent and other regions across the world, where we have high pre-existing vulnerabilities to the impacts of climate change. Next slide. And we also know that there will have to be a balance between critical resources like water availability that are also facing the impacts of growing populations around the world. And both of these situations are impacted by changing climate conditions, putting additional demands on resources that communities and countries depend upon. And we know moving into the future, this is only going to become more serious to adapt to in our national policies and climate action plans. Extreme heat is a particularly important risk that the health community is increasingly developing policies and priorities to be able to address. And when we look at nationally determined contributions that have been developed around the world, this is a point of optimism because 91% of nationally determined contributions are now prioritizing health as one of their national climate priorities. And when we look at the engagement of the health sector within nationally determined contributions, you can see in this graph, particularly the African continent, the Asian subcontinent are heavily engaged in trying to influence how climate policy can protect the health sector. Some of the top priorities for these nationally determined contributions are vector-borne diseases, as well as protecting populations from an injury and mortality due to extreme weather events. Next slide. And so this report, again, has been focused on the power and opportunity of using climate science and services to better inform these national policies. But when we start to look at the data, we see that 74% of national meteorological services are providing data to the health systems in countries around the world. But the data from the World Health Organization is showing that only about 23% of ministries of health are really using this information in systematic ways in their health surveillance systems to track the diseases that we know are influenced by climate and can be tracked in how their suitability and transmission is influenced. And through the interpretation of the report, we think that this gap is really due to the fact climate services need to be further developed because only about 31% of countries have national meteorological services with advanced capacities where they're able to work hand in hand with health authorities to develop tailored products and services. So we see there's huge potential to address these gaps. And as mentioned, extreme heat is a particularly concerning issue. And so the statistics shown here is that there's been really an underappreciation for the burden that extreme heat has been posing on populations around the world. And this is because mortality is generally understood much after the fact from extreme heat event or heat wave during the summer. And so the national statistics get calculated much later, and it has not been common practice around the world to be tracking the impacts of climate. However, robust modeling studies are starting to show that the impacts of extreme heat are quite severe, with up to 500,000 people being impacted with excess mortality related to extreme heat around the world. And as Professor Tallis has mentioned, only 54% of countries are receiving warnings that tell them how to protect their health during an extreme heat event. So there is a lot of opportunity, and we realize that there's really a transformational opportunity, particularly in strengthening the investments. The health sector currently receives less than 2% of financing that is going into health adaptation. And so there is a lot more to be done in strengthening the investment opportunities and the policies around climate and health. And we'll hear more from Dr. Niera on this next. Next slide, please. Okay. And I'd like to end. Great. And I'd just like to end with a moment of optimism and some stories. This report features 19 case studies, and 3 of them are here. And I'd like to start with the story in Fiji. Fiji is not only impacted by sea level rise and extreme weather events, but is also challenged by waterborne and vector-borne diseases. And in Fiji, this is a story of partnership and learning together between the Ministry of Health, the National Meteorological Service, and the World Health Organization. And together they have created not only a united team, but they've developed data sharing policies, joint training, and together they've been focused on tracking how these climate sensitive diseases that they are affected by are changing with the changing climate. In Argentina, this is a story of how trusted public institutions have worked methodically with their research community to develop sound and evidence-based public warnings. Argentina, like much of the southern hemisphere in South America, have been affected by increasingly extreme heat and heat waves. And so in the first year of the launch of this national service, they issued 987 alerts across Argentina. And this has helped their public services and communities know how to better respond and prepare for the heat season. And in Europe, we have a story of really harnessing technology to channel risk information directly to physicians and patients. In Europe, 40 million people are affected by allergies, which are influenced by weather and climate conditions. And so this project has been able to provide real-time detection and monitoring information and alerts directly to decision makers in a clinical setting, so they can access this dashboard and find real-time information that will help them improve their diagnoses as well as how to treat their patients. And through a direct app, mobile application, patients are able to access information about the allergies that may be affecting them so they can make decisions themselves. So these are a few of the stories. There are other examples in the report, and we'll be hearing from more of them in our launch event later this afternoon. So thank you very much.
Thank you very much, Mrs. Schumacher-Guillermo. I have the pleasure to welcome Dr. Maria Neira. She is the Director of the Department of Environment, Climate Change and Health at the World Health Organization. Maria, you have the floor.
Thank you very much. And I need to start by apologizing. It's not that I don't know the place, which I do, or I thought I do, but the place is becoming a little bit unfriendly. So apologies to all of you. Let me maybe start on reminding you something that you know very well. Climate change is having a devastating negative impact on health, on human health. And it can even undermine the health determinants. And of course, it's increasing the pressure. Climate change is putting a lot of pressure, adding pressure to our health systems that are already in many occasions having difficulties to cope with. This is coming with obviously a high level of concern by the health community at large, the global health community at large, but as well with responses in many fronts. One of the responses is that, as you probably know, in a few weeks from now, we will be moving to the COP28 in Dubai, where for the first time ever, we will have a health day, a day dedicated to health, to make sure that everybody will hear what are the health concerns, what are the health solutions, what are the health proposals, and how the health community at large needs more financial resources to cope with all of this. And one of the critical, strong political demand that we are having from ministers of health, who will be at COP in a massive way, is data. What about data? How can we handle this? And one of the best tools, as you know, in global public health is data. And that's why we are very happy and proud of this strong collaboration with WMO, because this climate information is extremely relevant to cope with what we will be facing, what we are facing already, and what is coming. We will have an increase on vector-borne diseases. Well, the climate information will be extremely relevant to forecast, to be better prepared. We will be having heat waves in places in urban environments where we didn't have it before. So again, this climate information, those apps that can be developed are extremely relevant for us to better prepare to create the conditions that doesn't exist now in many urban areas for our citizens to cope with. You heard as well the issue of air pollution, the bad quality of the air we breathe. So for WHO, for the health community, again, this information, how can we increase access to these climate services and collaboration that will help us to further put in place prevention strategies for allergic conditions, for asthma in many occasions, and for respiratory diseases. So all of this data exists. We have proved as well that we have good successes that can be, if you look at the report, you will find many of them. But as Dr. Schumacher-Guillemot said, there will be an incredible potential. There is an untapped potential. And for the health community, this capacity now that we are increasing is fundamental. So I will invite you, all of you, to have a very careful look at this report because it's extremely important. And as I say, we will need a lot of data to cope with the consequences of climate change in our health. But the more we collaborate, the more we use those climate services, the more we are strategic as well in the way we use it, modeling those services on the way that will be providing the most needed services for the health community, the health ministers, the health communities at large, even on a very peripheral area. So again, very, very happy with this collaboration, very important contribution to the different pieces that we need to put together to cope with climate change and health. And hopefully at COP, we will be able to tell all the member states, all the countries that will be negotiating that they are not just negotiating the level of greenhouse gases emissions, they are negotiating with the level of our health. They are negotiating with our health because the decisions they will be taking there will have a very important impact in our health. If they take the right decisions in the positive way, if they take the wrong one in the negative one. So this collaboration and these meteorological services are for us a big contribution to the big challenge that we have in front of us in terms of climate change and health. Thank you.
Thank you very much, Mrs. Nera. And now I'm opening the floor to questions in the room or online.
Christophe Vogt, Agence France Presse. I guess the question is to both of you. Do you have any idea of how much money would be needed to translate the data that you can give to governments into efficient ways to fight about the health impact on climate change? Do you have an idea of how much it would cost? And also the other question was, you were talking about LCDs being especially victims of the health impact of climate change. Is it just because they are low-income countries and they don't have the money? Or is it also for other reasons, maybe geographical or others? Thank you.
I think, as you know, in medicine, we use something that it says first, do not harm. So in terms of cost, my first reaction would be if we stop it today or even tomorrow, the giving subsidies to fossil fuels, all the cost, I mean, to recover and to respond to the health needs, the health system's needs will be already there. Because one of the costs that is very rarely estimate is what we are paying already. I mean, the health services are already treating chronic diseases that are the consequence of exposure to air pollution, for instance, which is the consequence of combustion of fossil fuels. And that cost is never incorporated in all of the considerations when those negotiations are taking place. So first, do not harm, stop giving subsidies to fossil fuels will be a big, big help. Second, as mentioned it already, yes, the national determined contributions, they give a strong importance to health, and they prioritize. But when you look, and in WHO we did an estimation of the funds from the climate environment going to health is less than 0.5%. So it's true that we prioritize, we all recognize that health will be the critical one, but only 0.5% of those resources are for the time being going to health. So we definitely need to increase that dramatically for adaptation, because we need to prepare our health systems to cope with the consequences and make sure that they are climate resilient and fit for the 21st century, those health systems. But we need as well to make sure that those we do not invest on something that is killing us, which are those fossil fuels. So for us, this acceleration to the transition of the clean sources of energy, green, renewable sources of energy, will be a health investment as well. A very critical one, will help us to reduce the 7 million premature deaths we have every year caused by air pollution. And in terms of millions or investment, the World Bank is talking about now they will mobilize 100 billions, but it has to be new money. It cannot be loans. It has to be, particularly for the vulnerable countries, it has to be something helping the countries to cope with the dramatic consequences that are already suffering. So those are many of the economic arguments that we are handling now, but the cost is huge for us, for the health of the people. Joy, yeah.
Great, thank you. And I'll answer the second question. There are vulnerable populations in all countries, both rich and poor. But because of the conditions in low and middle income countries where they may have weaker water and sanitation systems, reduced access to healthcare, food insecurity, a high burden of existing diseases that are sensitive to climate, this makes them predisposed and more vulnerable to an additional burden due to weather extremes, changing climate, affecting their ecosystems and the determinants of health.
Thank you very much. Yes, please.
Yes, Mohamed Iqbal from Anadolu. My question will be for Mr. Talas, if it's possible. Talas, thank you so much for your brief and this report. The effect of global climate crisis felt also in Gaza. Abar Butma, who is the Palestinian environmental civil organization network coordinator, said Israel attacks will have serious environmental consequences in the long term in Gaza. People of Gaza also face difficulties in accesses water resources, especially due to this attack. Do you think that Israel's attack make this situation even worse in terms of climate crisis in Gaza? Thank you.
Thank you. Of course, that's a political question, and we are a scientific and technical organization. But in general, I would like to say that in that part of the world, we are already living at very difficult conditions, and the availability of water is limiting satisfactory life, and also we are exposed to high temperatures there at the moment. Of course not, but especially during the summer half of the year, that's the case. So it's clear that in Gaza and also in the neighboring Israel, the difficulties with water and high temperatures, especially during the summer half of the year, is making the situation even more complicated, and that has been a classical place where this kind of water diplomacy has been needed. Who is allowed to use the very limited water resources in that part of the world. Of course, we can use desalination to produce water for the population, but that's quite expensive, and it may be difficult for the Gaza area to afford that kind of treatment. And of course, from UN side, we are very much recommending to proceed with this two-state solution, that there would be a state for Palestinians and state for Israelis, and this unsettled situation has been partly a cause of this conflict that we have been facing.
Thank you. We have a question from Paula Duprat online.
Yes, hello. Thank you. Thank you for taking my questions for Geneva Solutions. So as you mentioned, heat is one of the clear impacts of to human health, the climate change. Recently, the NGO Fair Square published a report saying that workers who were employed on Expo City in Dubai, renovating the venue for the upcoming COP28, have experienced heat stress as they were forced to work over the Gulf summer during the middle of the day. Should the most heat vulnerable states be regulating working hours amid climate change to protect workers from such risks? And is it right actually to be hosting mega events such as the World Cup last year and now the COP28 in this particular region where this risk is really quite severe?
Professor Tallers, you want to take this question?
Yes. So what was already shown in the most recent IPCC report is that in that part of the world and in this low latitude area, in general, this combined heat humidity stress is already today a major challenge, and because we expect climate change to continue for the coming decades anyhow, and we are going to see more often days with high humidity and high temperatures, it's clear that this is having a negative impact on the working abilities of individuals, and therefore this should be taken into account. And of course, it's a question how comfortable those conditions are for the athletes, but of course it's a political decisions where those kind of events are held in the future.
Thank you. Maria Neira, do you want to make a compliment?
Thank you. Yes, I fully agree. And because we are seeing this increase on the urban environment suffering these heat waves, and we know that there will be more frequent and probably more intense, and they will having more effects on the health of the people. What we are recommending as well is doing a kind of urban mapping where you identify the most vulnerable people that obviously they don't have access to air conditioning, or people who will not have the capacity to or study or perform any work at home if you don't have a minimum of climate conditions. So this is the first step for urban planners having or local authorities having a kind of urban planning, urban map of the vulnerabilities, those who will be suffering most. Then as well, many cities are investing now on the so-called climate refuge. I mean, having places where people can gather and at least having few hours of better conditions. And the third one is, of course, more green spaces, better planning for creating areas where you will put the conditions to reduce that exposure to the heat. And of course, these meteorological services in collaboration with the health services can alert the population and better prepare and particularly protect the vulnerables. Regarding the working hours, yes, it's not yet by legislation, but many countries are now at least looking at this issue of the working hours, particularly during the the summertime or during the times of the year, the seasons where you have bad meteorological conditions on that, and regulating and adapting a little bit. But of course, more needs to be done to protect the people, particularly the most vulnerable.
Thank you. A question from Lisa Schlein online.
Yes, thank you. Good morning. No, afternoon, I guess it is already. I have a couple of questions. First, regarding Africa, which is a continent battered by all kinds of terrible things, floods, droughts, locusts, diseases, and so on and so forth. Do you have examples of, what would you recommend are some of the best measures that should be taken by countries in Africa to combat the ill effects of climate change and how it affects the health situation? And perhaps you have some examples, good case examples of countries that actually are doing something that is effective in that regard. And then to you, Dr. Maria Neira. Nice to see you, actually. I'd like you to speak a little bit more expansively and specifically about the problems which are related to air pollution in terms of how many deaths and illnesses, how widespread it is, and what some of the best actions or measures that could be taken and should be taken and perhaps are being taken in order to reduce this problem, which affects everybody in the world, vulnerable or not. We're all vulnerable. Thank you.
Thank you. Maria, do you want to answer, Professor Tallás, to the first question?
Okay, so of course we have major limitations in the early warning services in African countries and also island states, and that's why we have this major program, Early Warning Services for All, where we are trying to improve the quality and quantity of services. And one of the sectors where many African countries don't have services are these health services, and many African countries are not able to provide heat warnings for their population. And their authorities have limitations in coping with such warnings. They are not used to use such data either. So that's one of our challenges in general in Africa. And of course, if you compare, for example, the African countries, typical African countries with the rich Arabic countries, people don't have access to air conditioning and facilities that we have available in more developed parts of the world, where we can protect people by bringing them to stadium where we can have air conditioning and so forth. And this air quality challenge, I'm sure that Maria wants to say something as well. Of course, this urbanization is one of the global challenges, and typically in the urban areas of less developed parts of the world and areas where population is growing, we are facing also serious air quality challenges, and this combined effect of high temperatures and air quality, they are causing health problems, as we have seen in Europe, but the situation is even worse in many African big cities, and as we know, also India is one of the most challenging countries, and Pakistan, China as well. So this we should take also the poor air quality into account. And typically during these high extreme episodes, at the same time we have poor air quality, high concentrations of particles, and high concentration of surface ozone, for example.
Thank you. Just to complement what Dr. Tallás says, first, and Lisa, very nice to hear you again. I cannot see you, but nice to hear you. First, when we are confronting this major challenge, which is climate change, don't lose perspective. I mean, first we need to reduce emissions or stop emissions, which is the real cost of the problem. So sometimes we tend to, the climate change problem is so big and so complex that we tend to focus on different issues, but don't forget that the real solution will be to stop the problem, so the cause of the problem, which is the combustion of fossil fuels. And this is for the health community, this is extremely important, because the combustion of those fossil fuels are not only contributing to greenhouse gases emissions, but as well to air pollution. And air pollution, and that's why for WHO, we overlap very much climate change and air pollution, because 75% of the causes of both are the combustion of fossil fuels. So as you can see, don't lose perspective and focus on the real root cause of the problem. Stop emissions. But we cannot do that immediately, or it looks like our politicians are not ready for that yet. We still need another 28 years to negotiate more on climate change. I hope not. So this will be the solution. And for health, that will be the best solutions, because the benefits of those stop of the combustion of fossil fuels will be almost immediate on reducing the bad quality of the air we breathe. Now, focusing on the other part of the question, which is the adaptation, how climate change is affecting our health. Thanks for the question, Lisa. It's affecting in the sense that we will create better conditions for mosquitoes and other vectors to reproduce. And that means an increase on vector-borne diseases, malaria, dengue, for instance, but many others, and even in places of the world where we didn't see it before. We are creating conditions for more non-communicable diseases, lung cancer, chronic respiratory infections, because of the bad quality of the air we breathe. We are, the extreme weather events obviously will have dramatic consequences for the health of the people. Immediate consequences because of the disaster, but as well because there will be massive displacement. They will maybe be responsible for destruction of the land with agricultural production, and therefore we will see malnutrition and massive mental health issues as well that we are seeing. And of course, waterborne diseases. We heard as well that if you have all of these extreme weather events or global warming, you will have more difficult to access water services, and that will be responsible as well for a massive increase on waterborne diseases. We are seeing an increase on cholera outbreaks around the world, by the way. So almost the whole spectrum. I mean, health will be touched in almost the whole spectrum, because climate change will touch the pillars of our health: access to food, access to water, access to clean air to breathe, and then shelter. So if you lose that, obviously your health will be very much at risk. So what are we recommending to African countries, for instance, to do? First, they need to raise their voice to make sure that the countries will reduce emissions. As I say, this is the cause. Second, they need to argue as well how climate change represents a challenge for them and the needs for adaptation. And the African countries have massive needs in terms of adaptation to climate change of our health systems. So we need resources to cope with that. What that means? It means more vector control strategies, increasing the ones we have, better access to safe water and sanitation. So sometimes investing on something which is called the no regrets investments. It means as well more training for the health professionals, because they are not well prepared to cope with all of those diseases. Better epidemiological surveillance for most of them. And obviously, as I said before, data. And the data we are producing today is extremely important. This collaboration between the climate services and health services to forecast, to create the conditions for alerting and preventing as much as possible is fundamental. In terms of air pollution, the consequences for our health, I think I will finish very quickly if I tell you which part of our body is not affected by air pollution. That will be almost zero. I mean, any single part of our body is affected. Why? Because those particles, the PM 2.5 in particular, are extremely teeny. So they not only they go to our respiratory system, but from there, they can go to the bloodstream. And once you are in the bloodstream, you reach any single place in our body, including the placenta, which is one of the most dramatic things. You know, when you detect on an unborn baby, you detect already PM, that's really painful, because that will have consequences on the neurological development of the brain, will have consequences in the long term, like diabetes. We will have, as I say, all type of negative impact on our body, on our health, that it will be very long to describe. But if I have to summarize, there are 7 million premature deaths, plus all of those chronic diseases that will be responsible for lung cancer, pneumonia, of course, chronic respiratory, obstructive chronic pulmonary diseases, diabetes, dementia, Parkinson. The list is so long that I don't want to bother you. Thank you.
Thank you very much. Maya Plants, you have a question online?
Yes, thank you very much for taking my question. Yes, my question is regarding the Loss and Damage Fund. Are you working with the Loss and Damage Fund, and how do you work? They work at a regional level, at a national level right now, but I imagine that perhaps you are participating on these negotiations. You have a representative. If Dr. Talas or Dr. Neira or Dr. Joy wants to answer that. And the second part of my question is Latin America. Can you talk a little bit also about Latin America and what you see happening there and what programs you have been developing?
Professor Talas, you want to take the answer?
Yes. From our side, of course, this loss and damage is at the moment a very hot topic at the COP28 negotiations, and this week we had so-called pre-COP meeting, and that was one of the topics that was debated there. And the basic idea is, of course, that the richer countries should pay for this damage that climate change is causing. From our perspective, the key issue are these early warning services. From our perspective, it's very smart to prevent loss and damage, and we can do so by improving the early warning services. We could prevent both the human casualties and we could minimize the economic losses by having proper early warning services in place, and also proper action from emergency management authorities in place, and that's what we are very much promoting. And also when it comes to Green Climate Fund, which is financing climate action, which is one of the vehicles how to deal with these loss and damage issues. There, the goal is that up to 50% of the climate financing should go to adaptation, and adaptation is of course very much related to early warning services. That's one of the highest cost-benefit ratio actions of adaptation that, for example, the Adaptation Commission led by Ban Ki-moon was reporting about. And when it comes to Latin America, of course, the Latin American countries are also sensitive to heat waves. Actually, the only place globally where we haven't seen an increase of the heat wave situations is southern tip of South America, but the rest of the continent has been facing this, and also we have these vector-borne diseases hitting Latin America, and also the big cities in Latin America are facing the air quality challenges. And that's the case in many such cities, and this combined impact of high temperatures and poor air quality is also causing deaths in Latin America. And of course, we have some parts of the Latin America are exposed to hurricanes, and as we have seen during recent years, and actually a few weeks ago, actually last week in Mexico, that hurricanes are having big impacts on health services. And for example, in 2017, when we had last very severe hurricane season, it was estimated that in Puerto Rico there were even tens of thousands of casualties because of the breakdown of the health services after this event. So it was a loss for a year after the hurricane hit.
Thank you. Joy or Maria, do you want to add anything?
I would just add that the Caribbean, Central America, and South America also experience significant drought and impacts of drought, which place pressure on their food systems and their water. It's also a precursor to additional fire risk in the region, which then has a consequence on the air quality. So there are many cyclical impacts that we see on the ecosystems in Central and South America that are driven by climate extremes.
Thank you very much. As we have no more questions online or in the room, this press conference is now coming to an end. If you have any additional questions or interview requests, please reach out to Claire Nulis, our media officer. Next press conference in this room will be on 15th of November, on the Greenhouse Gas Bulletin will be released. So we invite you to join as well. So thank you very much. Bon appétit et bon après-midi à tous.
Recording stopped.